and welcome into your health. You know, February is Heart Month, so we want to make sure that we keep our heart in the best shape that we can keep it in. And one of the best ways to do it is find out just about what's going on inside of us. As we age, we can start to see graying of our hair, but we don't know what happens to our heart and, more importantly, our arteries as they age. So we brought in the expert, Dr. Paul Moore. And Dr. Moore, good to be with you again.
Good to be here with you as well.
It's been a few years since we've gotten together, and you still look the same. I've probably aged, you look the same.
Oh,
but,
thank you.
But we want to let our viewers know that obviously, as we start to age, there's some things, we get wrinkles, we can see things, but internally with our heart and all the arteries, what happens to us as we age?
The heart can age in a variety of ways. Not just the arteries. The arteries are very, very important, but the heart muscle itself can become stiffer with age. Everything becomes stiffer. Our joints become stiffer. And that has to do with replacement of youthful connective tissue with more stiff or stiffer connective tissue. The heart muscle itself can become stiffer, less compliant, and that can lead to certain problems. The conduction system or the electrical system of the heart can age and become dysfunctional, and we're all born with a pacemaker at the top of our heart that sends out a signal about once a second.
And that's a natural pacemaker.
And that's a natural pacemaker.
It's not one that you guys implant, because a lot of times our viewers are going to say, gee, I had one put in, but you come with an automatic
But we're
one.
born with a pacemaker. It's specialized cardiac tissue that sends out a signal. Now that pacemaker may become a little feeble as we get older, and that's when an implantable pacemaker is required for sometimes older patients, a lot of times younger patients as well. So the electrical system can age, the valves of the heart can age and become dysfunctional, they can become stiff or leaky or not open properly. So there are a lot of things about the heart that can age as we age. You mentioned the arteries of the heart, and that is very, very important. Our arteries, our arteries really determine how healthy we are as we age. If our arteries are healthy, then we're generally pretty healthy. As we age, the arteries may become stiff and build up plaque, cholesterol plaque, and that plaque is what can lead to chest pain or angina, or it can lead to heart attacks. And that lack of enough blood flow as a result of plaque accumulation in the arteries can lead to heart muscle weakness, heart attacks, congestive heart failure, and many of the things that we are familiar with as regards poor heart health.
So basically, obviously, the heart and the vessels, they've got to work in conjunction with each other, because it's kind of like your automobile. If your fuel line's not working right,
that's right.
The motor's not going to run right, and the heart is almost like a motor in there, isn't it?
The heart is a pump.
Right.
The heart fundamentally is a pump. And if you want to think of it as an automobile engine, it requires a power supply. It has an electrical system. It has valves, and the work is done by the heart muscle. And if the heart muscle is not getting enough blood flow, then it doesn't work very well. And the blood flow is supplied by the arteries of the heart.
Okay, well, what we're going to do is get you to come back over the next few weeks, because we want to find out, obviously, now that we know things that are happening as we age with our heart, that maybe we can have some signs or symptoms that we may be having a trouble with our heart.
Sure.
Okay, and just remember this. As you age, obviously your internal organs are going to age just as well as you're going to age from the outside. It's good to know what's happening so you know if there's any kind of a problem. And we'll be right back right after this.